Thank you for the kind introduction. So as was mentioned, I am currently a member of the Health Language Processing Lab, which is led by Dr. Graciela Gonzalez over at DBEI at Penn. And the lab focuses very broadly on natural language processing for health-related applications. Let me just change it to my laptop. Yeah, so my personal research interests are at the intersection of natural language processing, applied machine learning, social media mining, and the applications of these to the broader health domain. In particular, I'm interested in designing and constructing end-to-end solutions that can convert big, noisy natural language data into valuable and actionable knowledge that can be used by domain experts. Over the last few years, I have been very interested in toxicology and the application of social media-based big data in monitoring, characterizing, and understanding drug abuse, and specifically prescription medication misuse and abuse. And my interest in this space has led to the planning, proposal, and eventual funding of a NIDA-funded project focusing on prescription medication abuse monitoring from social media. And in today's talk, most of the talk will basically focus on the research that we have done under that funding in this project, which we're in about our 10th month now of that project. So we're still very early, and we have about 3 more years to go. And I'll also talk about some of the preliminary work that we did to sort of start this project. So, starting on a relatively lighter note, when I say that we work on social media and prescription medication abuse, what do I actually mean, or what do we actually do? So often when people walk past our lab space and stare or look at our screens, either my screen or any of my lab members' screen, they often see us staring at pictures like this, or this, or this. And often they are in a state of shock because they cannot believe that at work we are looking at all these very strange pictures. And this is everyday life for us, pretty much. In fact, we've also had issues with emails. So our work emails, when we send research data, which consists of social media chatter, which I will show in a bit, typically get flagged as spam because it contains information about drugs or chatter about drugs. In fact, I think my Penn email is permanently blocked by Arizona State University, which is where I have some of my past colleagues and collaborators. And every time I send them an email, it always seems to disappear and they never receive it. And we have been having that problem for a while, and we have learned to sort of live with it. So we sort of target, send the emails to various email addresses just to make sure they get through. On a more serious note, let me provide a bit of background about the problem we're addressing. So prescription medication misuse or abuse is a subset of the broader drug abuse problem in the United States and the entire world, pretty much. And it is very closely related to the opioid crisis that we all know about. And I'm sure we have heard about it because it has received significant national and international attention. If you go to the NIDA website, which is the National Institute on Drug Abuse, you will see numerous statistics that are very alarming. So for example, about or more than 130 people die every day from opioid overdose in the United States. It all started with prescription opioids. So in the early 90s and the early years of the millennium, opioid prescriptions were handed out very easily. Lots of prescriptions were handed out. If I remember the statistics correctly, in 2013, over 250 million opioid prescriptions were handed out, which means that every single adult in the country could actually have a bottle of opioids. And that has resulted in a serious crisis of addiction, and we are seeing the problems now. So I could go on and on about these statistics, but I will just quickly focus on some charts that I sort of pulled out from the NIDA website. What we see here is that drug overdose rates are increasing pretty fast in the United States. In 2017, for example, there were over 70,000 drug overdose related deaths. A significant portion of that is opioid related, and it is actually accelerating the rate of opioid related overdose deaths. And we know about it. We know that about the opioid crisis. What we perhaps do not know much about is the role of other prescription medications or illicit drugs in the drug overdose crisis. So for example, we see that the number of deaths due to benzodiazepines is also very alarmingly increasing very fast. In fact, it consists of about over 15% of the overdose related death rates. And also the same thing with psychostimulants, or stimulants in general. And another thing that I find, and a lot of people find pretty alarming in these charts, is the x-axis here. So we can see that the latest data we have about overdose-related deaths is provisional rates from 2017. And we're already a third of the way through pretty much in 2019. So it means that by the time we get to know about the crisis, the state of the crisis today, it will already be 2021. So there's a significant lag between the time the crisis happens and by the time we get to know the state of it currently. And this was actually pointed out in a 2017 article, which I really liked, that came out on JAMA. And it basically talked about 10 steps that the federal government should take to reverse the opioid epidemic. The first step that was mentioned is improved and innovative, close to real-time surveillance. And that is where social media comes in. So before I get into the details of our work, let me quickly talk about why social media. So why do we want to mine social media for health-related research or anything at all? And the reason primarily is that social media has the highest rate of adoption ever. More people are using social media now than ever before, and it has sort of reached equilibrium among younger adults. Among older adults, adoption is still increasing, and as the demographics shift, what we know is that more and more people will be using social media data or using social media to do their communication and so on. Consequently, there is an abundance of information about all topics on social media. Whenever I want to find something out about something that happened, for example, sports-related news or politics-related news. In fact, the last few days I had to stay away from social media because on Sunday the first episode of Game of Thrones aired, and I did not want to figure out, like, the social media is full of spoilers about what happened in that episode, and I'm trying not to get to, because I haven't watched that episode yet. So it contains information about everything, pretty much, and it also contains information, an abundance of information about health, because people discuss their health-related interests on social media. People seek information, for example, about diets, about drugs, about treatments, and so on, and there are people who provide information. And also, studies suggest that people change their behavior based on what they read on social media, the information they get from their peers from social media. The kind of chatter that we get from social media also depends on the type of social network that we are looking at. So although we sometimes, from the perspective of research, see social media as a big thing that looks the same everywhere, which is not really the case. The kind of information that is shared depends very significantly on the type of social network. From the perspective of health, we can divide or broadly categorize social networks into two broad categories: generic social networks and online health communities. Now, generic social networks we should all be very familiar with. There is Twitter, which is essentially a microblogging site. There's Facebook, there is Reddit, there's Instagram, which is becoming very popular. The good thing about generic social networks is that the volume of information is very high, and once people enter these social networks, they typically tend to stay for a long time. On the other hand, we have online health communities, which have much lower volume of information, but they have very targeted discussions about specific topics, specific health-related topics. So the discussions are much richer, but people typically tend to stay less engaged on this, so they will only come in when they need it, and then they will discuss a few things and then disappear. But overall, there is an abundance of health-related data which can be used for research. Unfortunately, however, social media data or the use of social media for health-related research is still very much in its infancy. We have only recently seen a surge in publications. So if you look at this curve, if you search PubMed with a set of social media-based keywords, you will see a graph like this, which essentially shows that we are in the early adoption to early majority phase in using social media. Early works typically, and by early I mean works that were published in 2012, 13, 11, less than a decade ago, primarily focused on keyword-based approaches like flu surveillance, for example. So researchers would simply use influenza-related keywords to retrieve data and then use the volume of data to make estimates. Over recent times, as science and technology, especially data science, has progressed, we are seeing more complex algorithms being employed on social media data to derive more, let's say, complex estimates about health-related topics. Over the last couple of years, there has been a growing interest in utilizing social media for studying prescription and also illicit drug abuse. And the reason is because researchers have discovered that social media contains chatter about drug use and misuse, the kind of information that may not be available from any other sources, because people don't typically go and tell their doctors how they're misusing specific prescription drugs. And that is where we come in. We try to use social media data to better understand how drugs are being abused or misused. So whenever I tell my friends or other colleagues at meetings that we work with prescription medication abuse and social media, the question I get is, do people actually talk about these things on social media? And the answer is yes. Sometimes I cannot myself believe that people are discussing certain things on social media, but any type of discussion you will find publicly available on social media. So I wanted to bring up some examples, and this is what we always do, about how social media is being used to discuss misuse or abuse related things. And these are some typical examples. So in the first one, we see that the user is expressing certain sensations that is being experienced by the user after taking certain prescription medication and maybe some other substance as well. Very common chatter. The second is a typical example of taking excessive amounts of a certain substance. The third is a typical example of co-ingestion, where multiple substances are being taken by the user, which is also a very common form of misuse. Here, in the fourth one, we have an example of a non-standard route of intake. So typically, I have never snorted a medication in my life, so I don't think anyone snorts medication that is needed for prescription reasons. So that is a very good indicator of some sort of misuse. And finally, this is something we see with Adderall and other stimulants very frequently, where the medication is being taken for enhancement or performance enhancement. As I mentioned, the chatter can vary depending on the type of social network. So We have very recently started looking at Reddit for studying prescription medications and misuse. And what we see on Reddit is more detailed discussions, which often end up with questions. So the user here is expressing very specific information about dosage and how the user has developed tolerance, and at the end asking some question. And the second one as well, the user is expressing information about, I don't really know if 130 milligrams of Valium is a lot or not, but maybe the medical people will know here. And then at the end, the user is asking, am I mad? And then people come in and express their thoughts. So social media contains all this information, but the question is then, why have we not been using social media all this while? Why couldn't we use it from the early 90s and know right away what is going on with the different types of drugs and medications? And the answer is that social media presents a lot of challenges as well, in terms from the perspective of data mining. Social media data is noisy, so most of the chatter on social media that mention prescription medications does not represent misuse or abuse, which is a good thing from the perspective of public health and medicine, I guess, because if everyone was talking about abusing prescription medications, it would be something catastrophic would be going on, which is not the case. But that is a problem for machine learning, because we have to filter out all this noise before we start mining a real information. Also, the chatter in social media typically uses creative or colloquial language. The chatter also evolves over time. Meanings of words evolve over time, which presents challenges in terms of portability. Also, systems that are built on one specific social network are difficult to port to another social network. And when we take machine learning and NLP algorithms from that have been developed on other types of data like medical literature or electronic health records, they typically underperform when employed on social media data, primarily because of the large variety of ways in which information is expressed. So to effectively mine information from social media, what we need to do is build very thorough end-to-end pipelines, which start all the way from data collection, because data collection strategies have to be very comprehensive to collect data from social media as well, which I will talk about in a bit. Then there has to be some sort of filtering typically. So this is a more generalized framework for prescription medication abuse data mining or monitoring from social media. The supervised classification or any noise filtering method is used to categorize data into unrelated or medical use versus misuse or abuse. And after we have done that, we can then conduct specific studies to analyze the chatter. We can do geolocation-centric studies. We can do temporal studies. Also, we can compare different medications. And also we can study, perform user-level studies where we can study the behavioral trends in specific users who are misusing prescription medications. So I will quickly present some of the challenges and the recent advances that we have achieved. So as I mentioned, data collection can itself be a very challenging problem from social media, especially if we want to be comprehensive and collect all the chatter that we want. For example, on Twitter, when we collect data from Twitter, we are supposed to we have to use keywords that we use to retrieve posts. So we typically use medication-related keywords, but medication names are often misspelled. Some medication names are more frequently misspelled than others. I myself do not know how to spell certain medication names often and end up spelling it wrong. When collecting data, we have to predict how they're going to be misspelled because we cannot try all different combinations. In fact, we had a phonetic spelling variant generator before, which automatically generated similar sounding words, but then that led to the generation of too many possibilities and also words that meant something completely different. For example, there's a drug called Lyrica, and one of the phonetic variants of it was lyrics. And we ended up retrieving all these tweets about song lyrics or that mention the term lyrics, which is more frequently mentioned than the drug itself. Recently, we have developed and published a more data-centric approach, and what that data-centric approach requires is a large amount of unlabeled data, of which there is plenty available from social media. And we use a tool called Word2Vec, which has been a sort of a revolution in recent NLP. And what it does is it learns dense vector representations of words from large amounts of unlabeled data. These vector representations sort of capture the meanings of words so that words that are similar in meaning also appear close together in vector space. And as a result, we can sort of look around or search the area around a specific vector to find similar sounding words. And then what we do is we apply a lexical similarity filter to filter all the words that are lexically very different, and that gives us a set of words that are essentially very frequently used misspellings of the keyword or seed term. And we have found that to increase data retrieval very significantly by approximately 67% for various tasks. And this tool is publicly available like most of the tools from our lab, along with source code, so it can be used for other data collection tasks, and also for, we have not used it for electronic health records or clinical notes yet, but because they also have plenty of misspellings, there's the potential for using it for NLP of electronic health records as well. So that's our data collection strategy. Our first actual work on understanding misuse or abuse of prescription medication focused on a small set of prescription medications, specifically 3 prescription medications, oxycodone, Adderall, and ketapine, and a control medication, metformin. And we sort of devised a study to discover or investigate 3 things. First, if the proportion of misuse or abuse-related chatter for these abuse-prone medications was actually significantly higher than the control medication, because there's always the possibility that every single medication being discussed on social media contains misuse-related chatter, in which case this effort would not be really useful. Then if we can automatically train algorithms to discover or detect abuse-related chatter, and finally, if we could discover abuse-related chatter, can we actually compare it to some manual analysis to see if it can replicate some manual analysis or not? So we found from these 3 medications that yes, the proportion of, in a small sample, annotated sample, the proportion of abuse-related chatter was significantly higher than the control medication. So that answered our first question. The second question was developing machine learning algorithms for automatic detection. So we used the annotated data to train various supervised learning algorithms. And we spent a lot of time engineering features or discovering features that are useful for detection of prescription medication abuse-related chatter. And we use tenfold cross-validation, which is a fairly standard method when you don't have sufficient or a large amount of annotated data. So I will not go very deep into the features that we use, because we actually spend a lot of time figuring out what features should indicate a specific class. And the NLP community is trying to move away from this for many tasks and trying to use generalized features in the form of, which is what is used in neural networks. But for medicine-related tasks, we still find features to be very useful. One feature that we have found very useful to be for social media data is the use of word clusters or generalized representations of words or terms. Those who have done supervised machine learning know that, especially on social media, know that the same word can be spelled or represented using various different terms. And What we do is, by using the same word embeddings that I talked about, the dense vector representations, we can essentially use a basic clustering algorithm to find clusters of words with similar meanings. And then we use these as features to sort of present the classifier with a generalized representation. And we found very promising results from that small set of annotated data. We found that support vector machines work very well, and also multiple classifiers when stacked together performs even better. Importantly, with our small annotated data, what we saw is that a trend in increase in performance as more data is added in training, which was exactly what we were looking for, because that means that if we annotate more data and use more data, we will keep on improving accuracy or performance, which we can actually utilize to categorize large amounts of social media data. And what we also through feature analysis, what we also found was that the word cluster features worked close to as good as just using the word n-grams, which is the most common feature that is used in supervised classification. So now that we were happy with our classification task, what we wanted to do was compare it to some manual analysis that was performed in this space of research. So we looked at a paper by Hansen and colleagues from BYU, and what they did was they looked at a sample of Adderall-related chatter from social media, and they concluded that Adderall misuse-related tweets go up during the months of December and January, or between the months of December or November and January, and that's primarily because students are talking about using Adderall for their exams or enhancing their performance before their final papers are due. And we did the same thing, but automatically. We ran our classifier on over 100,000 tweets mentioning Adderall, and we found that the volume and proportion of Adderall misuse-related chatter goes up exactly during that time, pretty much replicating what the manual analysis had found. So that sort of proved all three, or we were satisfied with all the three initial questions that we had. So following this, we have done a number of different small studies, and some of which are still ongoing. We looked at, through large-scale annotation efforts, the proportions of abuse-related information for different classes of drugs and different drugs themselves, or prescription medications. We found that stimulants, there's a very large sample or a large volume of data about Adderall, Ritalin, and similar drugs that a lot of people tend to post more about them as well when they are under the influence of these prescription medications. So we found a very large sample of those. Interestingly, we also found a very significant proportion of chatter associated with benzodiazepines that represented misuse or abuse. For opioids, as I will show in the next slide, what we found was that a lot of the opioid-related chatter was unrelated to opioids, or people were posting about songs or movie lines from movies about specific opioids. And so the proportion of misuse-related chatter is relatively lower. In a more recent study, which is also partially funded by the Pennsylvania Department of Health, and the paper just got accepted recently at MedInfo, what we looked at was a comparison between prescription and illicit opioids. And what we found was that the volume of chatter for illicit opioids is much higher compared to prescription opioids. However, illicit opioids also tend to contain a large amount of unrelated information compared to prescription opioids. So a lot of the chatter, as I mentioned, is about other things and not about misuse. People are talking about movies where there's a line about heroin or some kind of other illicit opioid and so on, and also song lyrics. So in terms of automatic classification, this represents quite a bit of a problem. So we devised a very simple pipeline to mine or categorize data into abuse and other categories. And for this specific task, we found very good performance using deep neural networks, which is the sort of the new thing, or which has been very popular in the last few years. We are currently conducting a lot of different experiments using these classifiers. So we have been looking at tweets that we can geolocate to be in the state of Pennsylvania. And we're looking at the county level distributions of these tweets. So we basically trained the classifier, employed it on unlabeled data, which have geolocation information to be originating from the state of Pennsylvania. And for the years 2012 to 14, what we have found that there is significant and moderate correlation between the proportions or rates of abuse or misuse related posts and the rates of opioid overdose related deaths at the county level. What we are now working on is figuring out how we deal with the overrepresentation of abuse related information from big cities. So there is an incredible number of tweets that originate from Philadelphia and Pittsburgh within the state of Pennsylvania that represent misuse or abuse, and it's disproportionately higher than from other counties. So before I finish, I also want to quickly present some of the work that we have started from using Reddit. So our collaborator from toxicology, Jean-Marie Perron, has been very interested in the drug suboxone lately. And we are currently doing ongoing a study, which is ongoing, as I said, on categorizing chatter associated with the drug suboxone on Reddit. And we have found very rich discussions where people discuss who are on medication-assisted treatment for opioid use disorder. And they present information about cravings, withdrawal from suboxone. So when they drop off or stop using suboxone, the withdrawals that they typically face, side effects, stigma associated with the use of medication, suboxone, and also relapse. And interestingly, what we are also finding is strategies for successfully using suboxone to come off opioid addiction. And what I have here is a sample post where, which was extracted from the subreddit of suboxone, where a user is providing very detailed description of how that user got off suboxone using multiple different strategies. So they tapered it to a very low dose by cutting up strips of suboxone into multiple pieces. Often many people split up one strip into 32 pieces and then dissolve them in water before having them, and they extend their tapering for very long periods. And there's no clinical trial information available for this. So there are a few clinical trials which have tried very short durations, like 1 month of tapering, which does not really seem to be as effective as a longer taper. So what we are trying to do is we're trying to automatically extract these strategies and then sort of categorize them or come up with the best possible way of tapering strategies which the clinicians can use or clinicians can recommend when they prescribe suboxone to their patients. So other ongoing studies, we are also looking at the distributions or the types of chatter that is associated with different kinds of medications, and specifically the abuse-related chatter. So there has been a lot of past work on this field using topic modeling. So topic modeling is a method which can sort of extract all the topics that are prevalent in a specific set of text-based data. The primary difference is what we are trying to do is we're trying to do some classification and filter out all the noise and then only run topic models on data that is specific to misuse or abuse. And what we are finding is very interesting information about the mechanisms of misuse or abuse. So For example, with Adderall, we see words such as phenols or paper, etc., which are very frequently occurring in misuse or abuse-related posts, which typically show that the users are using them for performance enhancement. Very different case with opioids or oxycodone in this specific case, where we see words that represent addiction, words such as need and high and so on. Also doing similar things with benzodiazepines and several other prescription medications. And for our future work, we are also looking at doing user level analysis, which we have we are pretty much at the starting point of this, where we're actually looking at the posts by the same user over time to see how their natural history of misuse or abuse, how they start and what that eventually leads to. We have done similar studies for other cohorts, such as, for example, we have a two-year ongoing study within the lab focusing on pregnancy, a pregnancy cohort, where we have detected pregnant people over time, and then now we are analyzing what medications they took during their pregnancy and what kind of birth defects we have. So we are trying to do a similar thing for people who are reporting misuse of prescription medications. And the kinds of pictures we are seeing and we expect to see is this, where we have posts that indicate misuse or abuse, and over time they transition to other substances or express some clinical or social impacts. So with that, I would like to conclude my presentation. So the take-home messages are from this talk, I would say, is that first of all, social media encapsulates an abundance of data about prescription medication abuse. And in fact, we can generalize this to all sorts of health-related studies. A lot of behavioral and health-related studies can really benefit from social media data because there is an abundance of information. What is required is the development is thorough end-to-end NLP and machine learning pipelines that can automatically discover the relevant information and present them to the domain experts who are interested in studying that information. So collaborative research is, and interdisciplinary research is essential. So a few years back, we were trying to answer the question if social media can be useful for this task or not, or for this specific problem. And now the question has sort of transitioned to basically from if to what role social media can play within the context of this, this project, or the problem of prescription medication and drug abuse. So finally, I would like to acknowledge our funders, the primary funder being the National Institute on Drug Abuse. And of course, none of this work would be possible without my collaborators and my team members. So people from the Health Language Processing Lab who are involved in this study. So those who have not been mentioned, please don't be upset. It's just, and also my new mentees who have been mentoring and who have done a lot of the heavy lifting. So thank you, and I am contactable on my pen email address or Twitter email address, and I will also be moving in the near future to Emory to start a tenure track position, and I have the email address already from them, which I'm not using yet, but maybe future communications would be best targeted in that email address. Thank you.